Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Thursday, March 20th. I'm Elizabeth Arkalian. Coming up, for-profit psychiatric hospitals in California can be fined or penalized when there are reports of patient abuse.
We found that the state has rarely used these tools. It's up to sort of their discretion to decide whether or not to fine a hospital or pause admissions.
We dive into an investigation that finds these private facilities have alarming rates of mismanagement and very little accountability. But first, these news headlines. Fresno County has reported its second measles case of the year. Health officials say the virus was contracted by an unvaccinated adult and is linked to another case reported last week. The risk to the general public does remain low, but health officials are asking anyone who went to a Winco grocery store in Clovis on the evening of Thursday, March 13th, to fill out a county survey. The highly infectious virus is marked by a fever and rash, and in rare cases, can lead to serious complications. Brandon Vang holds the lead in a special election for the Fresno City Council. Early polling from Tuesday's election for District 5 shows Vang holds more than half the vote. He's currently a trustee in the Sanger Unified School District. Elizabeth Jonathan Rosas is in second place. Rosas is the wife of the previous council member for District 5, Luis Chavez. She's also a Fresno Unified trustee. District 5 represents southeast Fresno, and results could change as more votes are counted. The Porterville City Council has paused an ordinance related to the gender pronouns of K-12 students. As KVPR's Rachel Livenall reports, that's after residents voiced their opposition at this week's City Council meeting.
The ordinance would require school staff to disclose students' pronouns to their parents. Porterville resident Michael Carley spoke during the Tuesday meeting. He said school policies are outside the city's jurisdiction and that leaders should focus on problems within their control, like road repairs.
Porterville has many problems, but to my knowledge, transgender people have caused none of them.
The ordinance would also be illegal, according to a state law that was enacted this year. The Office of California Attorney General Rob Bonta told KVPR they are reviewing the ordinance. They also said they are committed to ensuring a safe school environment for all students. City council members decided to consult the city attorney before making a decision on the ordinance. For KVPR News, I'm Rachel Livenall.
State Senator Shannon Grove of Bakersfield held a rally in Sacramento on Wednesday morning in support of a bill she recently introduced related to school choice. The bill would help parents pay to enroll their child in any school they want. Shannon spoke outside the state capitol.
The truth is that when given choices, Black and Hispanic students from poor neighborhoods that are able to attend alternative schools outperform their counterparts in public traditional schools.
Grove said the bill would provide at least $8,000 in tuition each year for students who choose to enroll in private schools.
It's time to let the money follow the child.
Grove introduced the bill in January.
If public radio didn't already exist, we'd need to invent it. Do you really trust a billionaire to deliver your news? What about a hedge fund? Or AI with its hallucinations? Public radio is great because the listener comes first, not profit. Help keep the freely accessible information on KVPR, free, with your donation today. Become a monthly member at kvpr.org/donate. And thanks.
And now to our main story. Since Governor Gavin Newsom took office in 2019, he's vowed to reinvest in mental health care in the state, funneling billions of dollars to psychiatric hospitals. That includes for-profit facilities, which are now the fastest-growing destinations for Californians with mental health emergencies. That's according to a recent investigation by journalists at the San Francisco Chronicle. People with severe mental health issues who may be a danger to themselves or others are typically placed in these private psychiatric facilities, but the Chronicle's investigation shows the poor quality of care and risk of abuse for the patients is alarming. Reporters Cynthia Dizikes and Joaquin Palomino sorted through public data and interviewed more than 100 people for their investigation. They found staffing shortages, sexual assault, and preventable deaths are happening at some of these facilities, including here in the San Joaquin Valley. One patient at a facility in Bakersfield said it was like a prison. I spoke with Cynthia and Joaquin about their investigation. Cynthia starts us out by summing up the governor's goals for psychiatric care.
Newsom's focus has really been around access to mental health care and getting people who need help the help they need. And that has come down to investing billions of dollars in building out new mental health treatment facilities across the spectrum. So from short to long-term care, both locked and unlocked. But a critical component of his reforms has also been to make it easier to forcibly detain people who are in behavioral health crisis. So basically to lower that bar for involuntary treatment.
And what is the difference between locked and unlocked facilities?
Absolutely. So in the behavioral health care spectrum, there are facilities that people are forcibly detained in to get treatment under certain laws in California. And those facilities are locked. You can't, if you are on an involuntary commitment to one of these facilities, you can't just leave. And then there are other facilities that are unlocked, that are more residential or almost like housing, or like a hospital that you would go into for treatment for a physical ailment, and you can leave.
Got it. Joaquin, your report found that because of this pledge from Governor Gavin Newsom and a lack of facilities in the state, Newsom's administration has been relying on for-profit psychiatric hospitals, which is the focus of this reporting. Could you briefly lay out, Joaquin, what exactly a psychiatric hospital is and how someone could end up there?
Yeah, so I guess first off, since 2009, there's been since 2019, there has been a really large growth, particularly in these for-profit freestanding acute psychiatric hospitals in the state. And so this is what our investigation focused on. And these are hospitals that are standalone facilities that almost exclusively sometimes provide inpatient and outpatient psychiatric care to patients. These facilities treat people who are coming in voluntarily and seeking care. They're also designated by the state to treat people who are placed on these involuntary holds, so commonly in California referred to as a 5150 hold. They can last 72 hours and be extended for longer, and they're for patients who are considered a danger to themselves, a danger to others, or gravely disabled, meaning that basically due to mental illness, they're unable to take care of their basic needs.
Cynthia, when you started digging more into what's happening at these for-profit facilities, what did you find?
As we generally do on these investigative projects, we just start out with the records that are publicly available for whatever we're covering. And in this space, there are deficiency reports that, so the state, the California Department of Public Health, they license all hospitals in the state, and they are responsible for going in and making sure that they are following state and federal regulations. And so we started looking at these state deficiency reports over the last several years in all the different types, or the main types of hospitals that are allowed and have been approved by the state to care for people on 5150 holds. To do that, you have to meet certain criteria and be approved to do that type of care. And so we started looking at these deficiency reports, and we really started seeing this overwhelming trend in them of serious patient care incidents, specifically and overwhelmingly in these for-profit psychiatric hospitals. And by serious incidents, I mean physical and sexual assaults, serious instances where patients were able to self-harm, and even deaths. And a lot of times these incidents seem to come back to inadequate staffing.
Yeah, Joaquin, I wanted to mention, despite those concerning things that Cynthia mentioned that's happening at these for-profit psychiatric hospitals, it seems like when it comes to state intervention, there hasn't been a lot done to prevent further incidents. Is that right?
So the California Department of Public Health licenses these freestanding psychiatric hospitals. They also respond to complaints or incidents that are reported by the facilities themselves and conduct their own investigations. And the state agency has tools that it can use to sort of try and compel improvements in these facilities. It can issue fines up to $125,000. That would be for very serious incidents. It can also issue lesser fines for less serious incidents. It can also pause admissions until safety issues are addressed. We found that the state has rarely used these tools. It's up to sort of their discretion to decide whether or not to fine a hospital or pause admissions. And we found that the state has rarely used these tools. They've only issued under $100,000 in fines to all of the 21 for-profit freestanding psychiatric hospitals in the state since 2019. And at the same time, they've documented hundreds of these really serious safety violations. And we found that instead of levying fines or pausing admissions, the state health department almost exclusively relies on what's called plans of correction, where they ask a hospital to submit a plan detailing how they're going to sort of correct problems that occurred. But as we found, these plans often don't lead to lasting reforms.
Cynthia, the interesting thing about all this, too, is that you analyzed nonprofit and general hospital operations, and things are running quite differently at these locations, right?
Exactly. So what is incredible, actually, is that in California, all hospitals are required to report really detailed spending and staffing information to the state. And this allowed us to do this comparison between the main hospitals that are approved to treat people on 5150 holds, on involuntary psychiatric holds. And those hospitals were these for-profit psychiatric hospitals, nonprofit psychiatric hospitals, and then these psychiatric units within general hospitals. And what we found was that for-profits spend a fraction on patient care on direct patient care, I should say, as their counterparts by staffing at significantly lower levels.
I do want to dig into staffing a little bit. Joaquin, in the report, it highlights that staffing levels are potentially a big reason that we're seeing impacts on quality of care at these facilities, as Cynthia said. Your report specifically highlights the Bakersfield Behavioral Healthcare Hospital. That's run by Signature Healthcare Services. What did you find happening at that location?
So many of the deficiency reports we looked at, CDPH cited staffing issues as being sort of one of the contributing factors to the violation itself. And at Bakersfield Behavioral Healthcare Hospital, CDPH has issued a number of citations in recent years to that facility. These include citations related to staffing, related to physical and sexual assaults inside the hospitals, and other issues as well, all of which the state health department has linked to some type of regulatory violation. And as Cynthia referenced, these reports are public, so people can go on the CDPH website and they can look up these citations and sort of see what has been issued at any facility in the state.
Do we know if fines were issued at the Bakersfield facility?
They were not.
Joaquin, as you've been laying out all these issues with these for-profit psychiatric facilities, I'm curious, when you were speaking with people, and I'll note you spoke with 100 sources or more, what did they say the solution is here?
A lot of the people we spoke to say that many of these problems do come down to staffing. That is the most important thing within this acute psychiatric treatment space. And so a lot of the people we spoke with said that better staffing would go a long ways towards addressing some of these issues. There's also been people who have mentioned that better oversight from CDPH as well would potentially help address some of the problems we highlighted.
Cynthia Dizikes and Joaquin Palomino, investigative reporters with the San Francisco Chronicle. Thank you for joining me.
Thank you. We really appreciate being here.
Thank you.
Cynthia and Joaquin's full report is titled, quote, "California is increasingly relying on for-profit psychiatric hospitals. The system is destroying lives." In their report, they document many more firsthand accounts of mismanagement. And that's today's show. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. You can find the latest local news anytime at kvpr.org.
Each morning, it's a new opportunity, a chance to start fresh. Up First from NPR makes each morning an opportunity to learn and to understand. Choose to join the world every morning with Up First, a podcast that hands you everything going on across the globe and down the street, all in 15 minutes or less. Start your day informed and anew with Up First by subscribing wherever you get your podcasts.